Welcome to This Week in Health IT, where we amplify great thinking to propel healthcare forward. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. If you missed our live show, it is only available on our YouTube channel. What a fantastic conversation we had with Director 4 David Muntz, Sue Shade, around what's next in health IT. You can view it on our website with our new menu item, appropriately named Live, or just jump over to the YouTube channel. And while you're at it, you might as well subscribe to our YouTube channel and click on Get Notifications to get access to a bunch of content only available on our YouTube channel. Live will be a new monthly feature only available on YouTube. How many times did I say YouTube in that paragraph? Subscribe to YouTube. We're going to have some great stuff over there. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. They reached out to me to see how we might partner during this time, and that is how we've been able to support producing daily shows. Special thanks to Sirius for supporting the show's efforts during the crisis. Now, on to today's show.
Okay.
All right, here we go. Today, another field report, this time with BJ Moore from Providence. Good afternoon, BJ, and welcome to the show.
Hi, Bill. Good to meet with you again.
Yeah, I'm looking forward to this conversation. Last time we talked a lot about cloud. Actually, last time we talked, you were like 30 days into the
exactly
job.
Right.
So you're now a seasoned veteran. You can see with the beard.
Yeah, I grew a beard. I've been here for 15 months. A little gray. Yeah, it's been a good ride though.
Oh man! All right. Well, I know you don't have a lot of time, and I appreciate the time that you're giving us. So let's just jump right into it. Through the crisis, we've been talking about this framework of react, stabilize, reimagine, and I'd just like to walk through that with you. Give us an idea of the react phase at Providence. You were one of the first health systems with a COVID patient. What did it look like at that time, and what were some of the things that you guys did?
Yeah, we were the first patient. So patient zero came into our health system. And so we, as you know, we're across 7 states here along the western United States. That first patient came into Washington. So everything we did in the react phase was at a system level. So yeah, we did things to immediately respond for Washington, but everything we did was, later to benefit California or Texas or Alaska as the waves hit them. And so, we added diagnostic capability, remote, testing, tents, to add capacity to allow workers to work from home. So maybe 10 or 15% of our workforce normally works from home. We had to surge that capacity to allow all of our caregivers to work from home. So VPN, network infrastructure, new laptops, testing processes like payroll that had never been run from home for the first time. So the react phase was quite broad across the board from clinical tools, network and infrastructure, and then working from home processes. So super happy how the health system responded, and knock on wood, felt like our response was good.
Yeah, and you guys, so leading into this, you guys were doing big moves in the cloud, as a service models, those kind of things. And I read some stuff early on. You did chatbots with Microsoft. You did, how did that work benefit Providence during the crisis?
Yeah, so first of all, it was work that we were lucky enough to start before the crisis. So we had 3 strategic pillars around simplify, modernize, and innovate. So a lot of these things were well underway. So when we came into the crisis, we were able to pivot quickly. You mentioned the chatbot. That was super helpful to allow people to go to a website and triage their own symptoms, and then it would make a recommendation, stay at home, monitor your symptoms, do a tele visit, go in an emergency department. So really took a huge load off of our caregivers and our emergency departments. So a small piece of technology that really helped. Probably the single biggest piece of technology we did in advance was moving to Teams, Microsoft Teams, their cloud product there. When I started 15 months ago, we had Link and Skype and WebEx and Teams. If that would have been the situation as we came into COVID, it would have been disastrous. But most of our caregivers, over 100,000 caregivers, were already on Teams. So doing that remote work, being able to collaborate really paid off. So yeah, those cloud investments we were doing before, and we felt the benefit of those cloud investments as we dealt with the COVID crisis.
Yeah, so coming out, I've already gotten to coming out of this because I really want to come.
Yeah.
I'm ready to come out of
You're
it.
optimistic, Bill. I like it. We are coming out of this. We're starting to shift to the next phase.
What becomes top of mind for the CIO from a priority standpoint? Have we thrown our plans for 2020 out and we're going to rewrite them at this point?
Yeah, I guess a couple things. Yeah, there's a number of programs that we stopped during the COVID crisis. We wanted the teams to be able to really focus on some things. Some of those things were kind of opportunistic, being able to turn those things off, and we won't turn those back on. Some of those programs that have a life of their own, and this crisis has allowed us to stop those. That's good. We have some strategic priorities that we're already working on, like moving to the cloud, standardizing on Epic, moving to Oracle Cloud. We'll continue those investments. But probably the new thing that's coming out of COVID is what are the assets we built during this crisis, and how do we ride that wave? Telehealth being a good example. In a 2-week period, we had grown our telehealth business by 1,000 times. We had added 7,000 providers in a single week. So how do we take that muscle, that capability that we didn't have before COVID, and really water that and foster that and continue to grow it? So yeah, we'll stick with our long-term strategic initiatives, and then we're starting to add in these new initiatives. Telehealth being a simple example to really carry the momentum that we have in COVID.
Yeah, it's going to be interesting the telehealth example, and actually everybody has that hockey stick.
Yeah.
Just across the country, because you had to see patients.
Correct.
There were other patients besides COVID patients. So, do you feel like the atmosphere has changed dramatically? So I talked to some people who have said, if you talk to physicians 3 months ago about doing telehealth, you would get, you'd have some that were adopters and they were absolutely all in. But then you had a whole bunch that were like, don't even talk to me about it. There's no payment. There's no, do you find those conversations to be changing? Or do you think that maybe not the conversation itself, but do you think they're going to change? Do you think the, people's, willingness to do some of these things, if the payment models, with that being the assumption, the payment models get taken care of appropriately, that we are going to see virtual and telehealth get knitted into the entire care experience?
Yeah, and I would add, there was caregiver resistance, but there was frankly patient resistance, right? I've always gone in to see the doctor. I've always been face to face, and I continue to do that. So my optimism says yes. I think we're going to carry that optimism. I think the analogy I've been using, I feel like in the 6 weeks that we've gone through this crisis, we've done a year's worth of progress, a year's worth of work. I think we maintain that. I think patients getting used to telehealth consults, our caregivers used to giving those. I think that momentum will stick there, assuming that the payer model supports that. I absolutely think that comes out of it. And, these remote work things as well. Ironically, we were talking about Teams. We deployed it to 100,000 people. Our adoption was low, and how are we going to increase adoption? And we had these big training plans. Well, with COVID, people train themselves. Now people are heavy users, and I think people will stick with being heavy users. So I'm trying to say is I think there's some muscle that's been built through this crisis, and I think it's permanent muscle that will be maintained in the health systems and the way we deliver healthcare here in the U.S.
Well, were you surprised at the level of productivity that we've been able to attain in a work from home environment? And do you anticipate that to continue? I think it's going to be hard to ask people to come back into the office.
I think it's a bit of both. I've been pleasantly surprised. I had somebody ask, do I notice a difference between people that are young in career and later in career and adoption of this technology? It's interesting. After a day, everybody that the technologies become seamless, whether you're your 40th year in your career or your 4th day in your career. So no, I think those habits will be resilient. I'm hearing the opposite. I'm an introvert myself, like working from home seems like a dream, but I'm actually hearing the opposite, which is I'm productive from home. I love these productivity tools, but I can't wait to get back in the office. I can't wait to interact with my care, with my peers and fellow caregivers. So I think I think it's going to be mixed. I think the use of these tools will stick. I think being productive from home or a coffee shop or wherever you are will stick. But I think humans need to interact and have that face-to-face and have that personal time. I think people are going to want to come back in the office and are looking forward to that.
Yeah. So last question, because I think we're up against our time here, coming out of this, there's going to be just a ton of projects, right? So we had our multi-year plan and you had your multi-year plan.
Yep.
And then there's going to be a whole host of new projects that come about as a result of this.
Yep.
How are you going to prioritize those and how are you going to knit those together?
Yeah, I think it needs to be a balance of those long-term plans. I mentioned, Epic consolidation, getting on a single EHR, getting on an Oracle cloud. Those are 18, 24-month investments. We will continue to do those and that won't change. But when we evaluate new projects, it's going to be what support these new emerging health delivery. What are technologies that are going to enable us if there or when there is a second wave of COVID that are going to allow us to respond to that? What are things that are going to help us generate revenue in this post-COVID world? What are things that are going to be able to allow us to cut costs? And things that have really short paybacks, right? Six months is really what we're looking at. Anything more than 6 months, we just can't entertain at this point in time. And so the good news is there's a ton of revenue opportunities. There's a ton of new opportunities from a business perspective. So we'll have a lot of new projects coming our way. It's what can we handle as a health system from a change perspective, from an IT perspective, and obviously from a funding perspective. But I feel optimistic. I think we'll come out of this stronger. Even though things feel pretty low right now, I think we'll come out of it stronger for sure.
Well, BJ, I want to thank you for your time. I do want to have you on again here in the not too distant future because I want to go back into this. I love the conversation we had a year ago, and we said we were going to visit again to talk about how that process went because there's an awful lot to it of moving to the cloud. How's it going? And those kind of things. And maybe we'll do that as a live episode. I think that would be live.
Absolutely. Look forward to that. Thanks for the opportunity to share our message, Bill. Appreciate it.
Thank you. Take care. That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, Sirius Healthcare, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email and let them know that you value and you are getting value out of the show. And also, don't forget to subscribe to our YouTube channel while you're at it. Please check back often as we will continue to drop shows until we get through this pandemic together. Thanks for listening. That's all for now.